Welcome to the Scenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Okay, let's unpack this because understanding mental health conditions, it can be really confusing, right? Especially when terms sound so similar.
Absolutely.
So today we're doing a deep dive into borderline personality disorder, BPD, and bipolar disorder.
Two conditions that get mixed up surprisingly often.
Exactly. And you can see why, both involve things like mood swings, intense emotions, challenges with, just daily life. But our mission here today is really to cut through that confusion. We want to highlight the key differences and give you a clearer roadmap based on the material we've looked at.
Yeah, and what's fascinating and also really crucial is understanding why they get mistaken and why getting that correct diagnosis is just so incredibly important for someone's well-being and treatment.
Right.
So we'll explore, their definitions, what might cause them, how they're diagnosed, and importantly, how they actually impact someone's day-to-day life.
Okay, so let's start right at the beginning then. Our sources are pretty clear that these are different types of disorders. So what exactly is borderline personality disorder?
All right, so BPD is classified as a personality disorder.
Okay.
And that means it fundamentally affects how someone thinks, feels, and relates to others, and to themselves, really. It's about pervasive patterns.
Pervasive patterns, so not just fleeting feelings.
Exactly. People with BPD often feel emotions very, very intensely, and those feelings can stick around for a long time. It makes regulating emotions like anger, sadness, anxiety incredibly difficult.
Relationships, I know that's often mentioned.
Yes, definitely. Unstable relationships are a hallmark. There's often this intense fear of abandonment, and impulsivity is common too, especially when someone's feeling really upset.
Okay, so impulsive actions driven by that emotional distress.
Correct. And the mood swings we mentioned. In BPD, they can happen fast, like changing within just a few hours.
A few hours.
Yeah. And crucially, they're usually triggered by something specific, an argument, maybe some kind of stress, or that feeling of being rejected or abandoned.
That trigger point seems really key.
It is.
Yeah.
And we also see people with BPD sometimes struggle with a stable sense of self, like how they see themselves can change often. And unfortunately, sometimes they might turn to unhealthy ways of coping, like substance use or self-harm.
Right. Okay. So that's BPD, the personality disorder. How does bipolar disorder contrast with that?
Well, if we connect this to the bigger picture, bipolar disorder is fundamentally different because it's classified as a mood disorder.
A mood disorder.
Okay, so its primary impact is on a person's overall emotional state, their mood, but it happens in distinct episodes rather than being sort of a constant pattern of relating to the world like in BPD.
Episodes. So are there different kinds of bipolar disorder?
Yes, the sources outline a few main types. There's Bipolar I, which involves full manic episodes.
Full mania. What does that look like?
Think extremely high energy, feeling euphoric or maybe very irritable, often making risky choices. And people with bipolar, I usually experience depressive episodes too. Yeah. Then there's Bipolar II. That involves hypomania, which is like a milder form of mania and significant depressive episodes. The lows are still very low, but the highs aren't quite as extreme as full mania.
Right. Hypomania, less intense high.
Exactly. And there's also cyclothymic disorder, which is characterized by sort of longer-term, milder mood swings, but they don't quite meet the criteria for full manic or major depressive episodes.
So across these types, you have these distinct periods, these episodes of mania or hypomania and depression.
Correct. During mania, someone might feel on top of the world, incredibly energetic, maybe need very little sleep, make impulsive, sometimes regrettable decisions.
Like big spending sprees or quitting a job.
Yeah, exactly, things like that. But then during depressive episodes, it's the opposite. Profound sadness, hopelessness, exhaustion, lasting for days or more often weeks.
Weeks. Okay, and here's a key difference you mentioned. Are these bipolar mood changes usually triggered by specific events like in BPD?
Generally, no. That's a really crucial distinction the sources emphasize. Unlike BPD's rapid triggered shifts, these bipolar mood episodes tend to last much longer again, days or weeks, and they often don't have a clear, immediate external cause. They might seem to come out of the blue.
That duration and the trigger difference, that seems like where a lot of the confusion might happen, but also where the clarity lies.
Absolutely. It's probably the most critical point for distinguishing them in practice.
Okay, so this is where it gets really interesting. Our sources laid out a great comparison, kind of a side-by-side, drilling down into these key differences. Let's walk through that for everyone.
Yeah, that comparison is super helpful. So, starting with the foundation, disorder type. As we said, BPD is a personality disorder, pervasive patterns. Bipolar is a mood disorder, episodic shifts in glide.
Right. Personality versus mood. That's the bedrock. Now, those mood swings, again, let's nail this down.
Okay, BPD. Mood swings are rapid, often within hours.
Mm-hmm.
And crucially, usually triggered by interpersonal stress, conflict, feeling abandoned. You can often point to the why.
Okay. Triggered, short-lived.
Bipolar. Mood episodes last longer, days, weeks, sometimes months, and typically not tied to a specific event. They often emerge more spontaneously. This difference in duration and trigger is, like I said, absolutely vital for diagnosis.
Yeah, I can see how missteps happen if you don't focus on that. What about the nature of the emotions themselves?
In BPD, emotions are often described as very strong, very intense, and they change quickly. It's a very volatile emotional landscape.
Intense and quick changes.
Right. In bipolar, it's more characterized by these distinct sustained periods of highs, mania or hypomania, and lows, depression. It's about these defined episodes over time.
Okay. And impulsivity. We touched on that for both. How does that differ?
Good question. With BPD, impulsivity is often frequent and directly linked to managing intense emotional pain. It's like a reaction to feeling overwhelmed right now.
A coping attempt, maybe.
Often, yes. An immediate, sometimes desperate attempt to deal with distress. In bipolar disorder, impulsivity is primarily a feature of the manic or hypomanic episodes. Judgment can be impaired during those highs, leading to risky behavior, but it's not usually that constant moment-to-moment impulsivity tied to every emotional fluctuation like you might see in BPD.
Got it. Tied to the episode in bipolar, more reactive in BPD. What about relationships?
Relationships in BPD are often characterized by instability, intensity, a lot of emotional ups and downs. That fear of abandonment can create a real push-pull dynamic.
Sounds exhausting.
It can be, for everyone involved. For bipolar disorder, relationships are definitely affected, but primarily during those intense mood episodes. Mania might lead to conflict or reckless actions affecting others. Depression might lead to withdrawal. But the core pattern of relating isn't necessarily defined by instability in the same pervasive way as BPD.
Okay. And lastly, the comparison mentions psychotic symptoms, things like hallucinations or delusions.
Right. In BPD, these are pretty rare and usually brief, maybe happening only under extreme stress. In bipolar disorder, however, psychotic symptoms can sometimes occur during severe depressive or manic episodes. They can be part of the episode itself.
Okay, that comparison really clarifies things. So understanding what they are is one thing, but why do these conditions develop? What did the research say about causes and risk factors?
That's a huge piece of the puzzle.
Yeah.
For BPD, the sources really highlight the role of childhood trauma. Things like neglect, emotional abuse, abandonment, even physical harm seem to be significant risk factors for many people.
So those early experiences can really leave a mark on emotional development.
Absolutely. They can lead to long-term emotional sensitivity and difficulties with regulation. Another factor often linked to BPD is growing up in an invalidating home environment.
Invalidating, meaning what exactly?
Meaning a home where a child's feelings were consistently ignored, dismissed, or criticized. If you're told your emotions are wrong or too much, it's hard to learn how to manage them healthfully.
Makes sense. Is it all environmental?
Not entirely. There's likely a genetic component. 2, studies suggest BPD can run in families. And some research points to brain differences, particularly in areas involved in emotional regulation and decision-making. Plus, some people might just be born with a higher baseline emotional sensitivity, and without supportive environments, that sensitivity can become overwhelming and contribute to BPD.
Wow, so it's really a complex interplay, nature and nurture.
Very much so for BPD.
How does that compare to the causes outlined for bipolar disorder?
For bipolar, the emphasis in the material shifts much more strongly towards genetic factors. There's a really significant hereditary link. If you have a close relative, like a parent or sibling, with bipolar disorder, your risk is considerably higher.
So stronger biological underpinning.
It appears so. The sources also point to brain chemistry imbalances. Imbalances in neurotransmitters like dopamine and serotonin seem to play a key role in disrupting mood regulation, leading to those cycles of mania and depression.
But can external things still play a role, maybe trigger an episode?
Oh, definitely. Major life changes or stressors like losing a loved one, experiencing a trauma, even a serious illness can sometimes trigger the onset of symptoms or worsen existing ones in someone who's already genetically predisposed.
Okay.
And another important point from the sources, medical conditions or substance use can also be triggers. Certain health issues or using drugs, particularly stimulants, can sometimes mimic or worsen bipolar symptoms.
Right. That's crucial to rule out. Okay, so given all these nuances and how symptoms can overlap, it just hammers home how vital a correct diagnosis is. The sources mentioned this can be tricky, right?
Extremely tricky. And that really raises the question, how do clinicians tell them apart accurately? Especially since both can involve mood shifts, impulsivity, intense emotions. Misdiagnosis, particularly early on, is unfortunately not uncommon.
Which is why seeing a professional is so important.
Absolutely critical. Only a licensed mental health professional, a psychiatrist, psychologist, clinical social worker, has the training to make these kinds of diagnoses properly.
So if a clinician suspects BPD, what's their process generally look like?
Well, they'll typically conduct thorough clinical interviews, asking detailed questions about the person's history of emotions, thoughts, behaviors, and especially their relationships, looking for those pervasive patterns we talked about.
Patterns over time.
Exactly. They'll also use the official diagnostic criteria, usually from the DSM-5. For BPD, a person needs to meet at least 5 out of 9 specific criteria, things like frantic efforts to avoid abandonment, unstable relationships, identity disturbance, impulsivity, recurrent suicidal behavior or self-harm, intense mood reactivity, chronic feelings of emptiness, inappropriate intense anger, and sometimes stress-related paranoia or dissociation.
5 out of 9. Okay.
And critically, they'll look closely at those trigger and behavior patterns. How do the mood shifts happen? Are they typically reactive, following stress or conflict? That points more towards BPD.
Okay. And for diagnosing bipolar disorder, how does that differ?
For bipolar, the focus is really on identifying those distinct mood episodes over longer periods. Clinicians will work to track the history of mood episodes, documenting manic, hypomanic, and depressive periods, their duration, their severity.
Looking for those cycles.
Precisely. And it's really important to look beyond just depression. Many people initially seek help when they're depressed, so the clinician needs to carefully explore whether there have been past episodes of mania or hypomania, which the person might not even recognize as problematic.
Because hypomania can feel good sometimes, right?
Right.
Productive even.
Exactly. It might not be reported as a problem. Sometimes they might also order medical tests, like thyroid function tests, just to rule out any underlying medical conditions that could be causing mood symptoms.
Right. Rule out physical causes first. And this brings us back again to that crucial difference the sources stressed.
Yes, that important note that keeps coming up. It bears repeating. BPD mood changes are typically short, lasting hours, and are reactive to events. Bipolar mood episodes last days or weeks and often lack a clear, immediate trigger. Getting this right is key, especially because BPD can sometimes be mistaken for bipolar II due to the intensity of emotions.
Okay, so diagnosis is key because, as the sources make clear, the treatments are really quite different too. Once you know what you're dealing with, the path forward changes significantly.
Totally. The diagnosis really dictates the most effective treatment strategy. For borderline personality disorder, the treatment mentioned consistently as the gold standard, the most effective, is dialectical behavior therapy, or DBT.
DBT, what does that involve?
DBT is a very specific type of therapy that directly teaches skills in 4 key areas: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. It's very practical, very skill-based.
So it equips people with tools to manage those intense emotions and relationship difficulties.
Exactly. It gives them concrete strategies. Cognitive behavioral therapy, or CBT, can also be helpful for changing specific negative thought patterns and impulsive behaviors. Group therapy and peer support can also be really valuable for building trust and practicing social skills in a safe environment.
What about medication for BPD?
Medication isn't typically used to treat BPD itself, but it might be prescribed to help manage co-occurring symptoms, like severe anxiety or depression, if they're present. But, and this is a crucial warning from the sources, people with BPD often don't respond well to mood stabilizers or antidepressants alone, the way someone with bipolar might. It really underscores why therapy like DBT is primary and why the right diagnosis matters so much for treatment outcomes.
That makes total sense. Okay, so for bipolar disorder, what's the primary treatment approach then?
For bipolar disorder, medication is generally considered the cornerstone of treatment. Mood stabilizers medications like lithium, valproate, lamotrigine are really key to help prevent those extreme mood swings, both the highs and the lows.
Stabilizing the baseline.
Precisely. Antidepressants might be used for depressive episodes, but usually very carefully and almost always alongside a mood stabilizer, because antidepressants on their own can actually trigger mania in someone with bipolar disorder.
Oh, wow. Okay, that's critical.
Very critical. And in cases with severe mania or depression, especially if there are psychotic symptoms, antipsychotic medications might also be used. But it's not just medication. Lifestyle management is huge for bipolar stability.
Like what kind of things?
Things like maintaining a regular sleep schedule, managing stress effectively, getting regular exercise, and importantly, avoiding alcohol and recreational drugs, which can destabilize mood significantly. Therapy, like CBT or family-focused therapy, is also very important alongside medication.
So a combination approach is often best for bipolar.
Yes, medication provides the foundation, but therapy and lifestyle are crucial supports.
Okay, so we've covered definitions, causes, diagnosis, treatment. But beyond the clinical side, how do these differences really play out in someone's everyday life? What does living with each condition actually look like?
That's where you see the impact most clearly. And again, the patterns differ. For someone living with BPD, as we've touched on, relationships can be a real roller coaster. Lots of intense ups and downs, maybe frequent arguments, feeling misunderstood, that deep fear of being left alone often playing out.
That sounds incredibly difficult to navigate.
It is. And maintaining stability in work or school can also be really tough because of those rapid mood shifts and maybe impulsive actions. Small things like minor stress or feeling slighted can trigger really intense emotional pain that might seem disproportionate to others. And sometimes those unhealthy coping mechanisms we mentioned, like substance use, self-harm, reckless behaviors, become ways people try desperately to manage that inner turmoil.
A constant battle with emotional intensity and instability. How does that compare to the lived experience of bipolar disorder?
For someone living with bipolar disorder, the disruption tends to follow those longer mood episodes. During manic phases, you might see those big, risky decisions, huge spending, abruptly quitting jobs, starting overly ambitious projects they can't finish, maybe engaging in unsafe behaviors. The energy is high, but the judgment can be impaired.
Potentially life-altering consequences.
Absolutely. Then, during the depressive episodes, life can grind to a halt. Even the smallest tasks feel monumental. There might be excessive sleeping, a complete loss of interest in activities once enjoyed, social withdrawal, and profound hopelessness. Thoughts of self-harm or suicide can be very real during these lows.
So it's more about navigating these prolonged, extreme shifts in functioning and mood.
Exactly. These major swings can severely interrupt careers, education, family life, finances, everything. And it's crucial to remember both the extreme highs of mania and the deep lows of depression carry a significant risk of suicidal thoughts and behavior. It highlights the seriousness of both conditions, but the pattern of daily disruption looks quite different.
Okay, so wrapping this up, what's the main takeaway for you, our listener? This deep dive really shows that while borderline personality disorder and bipolar disorder might seem similar on the surface, maybe sharing some symptoms like mood issues or impulsivity, they are fundamentally distinct conditions.
Absolutely distinct.
We've established BPD is that personality disorder, often rooted in factors like early trauma and high emotional sensitivity, affecting how someone consistently thinks, feels, and relates. Bipolar disorder is the mood disorder, defined by those longer, distinct episodes of mania or hypomania and depression, primarily impacting mood state over extended periods.
And let's circle back to that core differentiator one last time.
Yeah.
It's so important. BPD mood swings, typically rapid lasting hours, usually triggered by specific events. Bipolar mood episodes, lasting days or weeks, often without a clear, immediate external trigger.
Getting that distinction right through an accurate diagnosis is just essential. It's the key that unlocks the right kind of help and the most effective treatment.
Because the treatments are different, whether it's skills-based therapy like DBT being central for BPD or mood-stabilizing medication being foundational for bipolar disorder. The wrong diagnosis can lead to ineffective, even potentially harmful treatment.
Right?
So, the final thought to leave you with is this. How might recognizing these important nuanced differences empower someone, maybe it's you, maybe it's someone you care about, to push for more specific, more tailored support? Instead of getting stuck or discouraged by a treatment approach that doesn't quite fit, understanding these distinctions can lead towards truly individualized care and hopefully better outcomes.
Moving from confusion to clarity, that seems like the goal.
Exactly. Clarity leads to better help.
Thanks for tuning in to the Scenario Podcast. Don't forget to visit scenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.